Let's start one more time. Here we are. And okay, so do you see the slides?
Yes, ma'am.
Great. Well, and here is the book we are going to study with, Oxford English for Careers, Medicine 1. So, and when we start speaking about visiting a hospital, so I would like you to think of the following. When people go to the hospital with their health problems, what do they start with? What do they do in the hospital?
Firstly, they fill some registration forms.
Okay, so somebody completes their registration forms. It can be so a manager, or it can be a doctor. Yes, what else do they
Or
do?
a receptionist.
Receptionist, right? What else do they have to do?
Then they may get the token, and they may go to the hospital, consult the doctor, which they have to.
Great, yes.
As doctors.
Exactly. And nowadays, during the pandemic time, so what do they do at the entrance of the hospital?
They did the online reservations.
So they use sanitizer also, yes, and they have to wear masks, these kind of things. Okay. Well, and so as you see, the patients should present complaints, and a doctor or a receptionist takes the patient's personal details, and the doctor keeps patient records. And as we know, these records are kept on computer or on paper. And which of these two systems do you think is better, on computer or on paper?
On computer.
On computer, ma'am, because it's more convenient.
More convenient. Are they?
And the systems will be accurate.
It will be more easy to sort the data.
Exactly.
And in computer, it will be also safe.
Nowadays,
and
everywhere.
when in paper, it's maybe digital.
But are there any advantages of keeping records on paper? Can you think of any advantages of keeping them on paper?
Yeah, when second time when the patient is coming, they can check the records and consult the same doctor again. It will be more convenient.
Okay.
If it is in paper, we can get the correct data out, the original data. There is no chance to error for it.
Okay. I see. And so computer actually depends on technology, right? So if we have some problems with technology, with the power, so in this case, paper is very useful, right? Okay, and so when a patient comes to a doctor, so he presents complaints. Presenting complaint is a specific term which is mostly used in Europe and in Canada. And in America, they use another term, chief complaint. So here these are equal terms. And as you see, this is the definition for these terms. So presenting complaint or chief complaint, this is the initial concern which brings a patient to a doctor, or in other words, the reason for which a patient approaches the doctor. So, and in your country, what kind of term do you use? Which term? Is it presenting complaint or chief complaint?
Presenting
Pres-
complaint.
Presenting complaint, right? Or do you remember, have you ever been to a hospital? I
Yes,
mean,
ma'am.
Yes,
as a
ma'am.
patient, as a patient.
Yes, ma'am.
Yes. Presenting complaint, right? Okay. So, and when doctors discuss the problems, the health problems with their patients, they use Socrates. They use Socrates in the history of the presenting complaint to help them remember the main questions that they need to ask about pain. So this is just a reminder to the doctors what kind of questions to ask. And each letter in the Socrates model stands for one sphere of interest. So you see, S stands for site. It means the doctor asks about the location of pain. Then O stands for onset. C stands for character of pain. R stands for radiation of pain. A for associations, what pain is connected with. T stands for timing. E stands for exacerbating and elevating factors, and S stands for severity. If we look at this Socrates model, and the question is, what are the questions that a doctor asks about pain using this Socrates model? So what is the question for sight?
Where you feel pain?
When did
Okay.
it start?
So this is about site, right? So location, where? Yes, you're right. What about onset?
When did it start?
I mean, okay, so I see, sorry. Then character.
How is the pain?
What are
How is the pain?
How is the pain? How
Mhm.
about its severity?
Okay, radiation.
What type of radiation is affecting during the pain?
So moving the pen
Does
to
it
another.
does
Yeah.
does it feel in any other area?
So associations.
What are the other
What are
diseases?
pain
which is-
that associated with that earlier pain?
Do you feel any kind of similar pain in any other area or any previous year or previous time? Do you feel any sort of same pains?
Maybe like this. Okay. What about timing?
When is the pain severe? Like when you get up at morning or when you're going to bed, is it severe in the morning or afternoon, or when it is severe? Timing when the pain gets more.
So
Or when it is long lasting, or it exists for a small time, that kind of questions.
exactly. Exacerbating or elevating factors.
Any factors that
When
is
do you
affecting?
when do you feel the pain is increasing or pain is exaggerating or elevating? Doing which factors will you feel? Which time you feel when you're talking, when you're moving around, when you feel like that?
Okay, and severity.
How much the pain is?
How
On the scale-
severity? How
On the scale of 1 to 10, you will rate the pain of severity in which number, which stage?
Exactly. Yes, this is very just. Have you read about this Socrates model anywhere?
No, ma'am.
Okay, so you've just yes, because these are exactly the questions that are recommended to ask. So we were right about the site, where exactly is the pain, the onset, when did it start, and was it constant, intermittent, gradual, or sudden? So you should ask some questions using these kind of adjectives, okay, about the character. What is the pain like? For example, sharp, burning, tight. So you should suggest the patient the adjectives that can help you to understand the character of pain. About radiation, does it radiate or does it move anywhere? We were also right. Associations, is there anything else associated with the pain? For example, sweating or vomiting. And so about timing, how long timing? Does it follow any time pattern? How long did it last? And exacerbating and elevating factors, does anything make it better or worse? So, and severity, how severe is the pain? Consider, as you say, using the scale from 1 to 10. So great. So we should also always remember this model, which can help us not to forget some kind of details. And if we move to the next slide, so here we are going to start listening to the conversation between Dr. Martin and Mr. Wood. So, and before we start listening to their conversation, I would like you to have a look at this slide. And here we can see different medical abbreviations, and we should decide what the abbreviations stand for. So please, the first one is pulse. So what does it mean? This
100 beats per minute.
Okay, yes. The second one, BP.
Blood pressure.
Blood pressure.
Exactly.
Blood pressure.
Yes. And MM stands for, what is it?
Millimeter.
Yes,
Hg means
millimeters
mercury.
of mercury.
Hg
Yes.
is mercury.
So number 3, JVP. JVP number 3. This is also like in the previous number 2. P stands for pressure.
Pressure.
And what kind of pressure it can be?
Jugular venous
Jaw.
pressure.
Yes, jugular venous pressure. And you see that this is not elevated as it says. Number 4, CVS NAD. Let us focus on NAD. We also have NAD in number 9, NAD. So NAD stands for,
Not
yes, not abnormality detected, not abnormality detected. And CVS, CVS, this is system. What kind of system is it, CVS?
Central.
Central vascular.
Yes,
Cir-
you're right.
Central
Cardi-
vascular.
Oh, this is cardiovascular system. Mhm. Okay. OE stands for on examination. On examination. Then we have number 6, widespread early inspiratory fine crepitations. Do we have any idea about the meaning of crepitations? Crepitations, what does it mean?
No, ma'am.
No. Okay, crepitations, this is a kind of sounds that we can hear, doctors can hear in the lungs. Okay. And audible. So
Here,
Can hear.
we can hear
Be
it.
heard.
yes, the doctor can hear this. Number 8, abdomen. I think it's clear. No changes.
Stomach area.
Okay, and the last one, CNS, NAD.
Central nervous system,
Central
not
nervous
normal.
Exactly, yes, you're right. And if we move to the next slide, we can see the these meanings. Yes, blood pressure, jugular venous system, pressure, sorry, cardiovascular system, no abnormality detected, and crepitations, a peculiar cracking, crinky or grating sound around the lungs. Do you see? And central nervous system. Okay, so these we'll hear these abbreviations in the conversation between Dr. Martin and Dr. Wood. So now we are going to listen. Listen to part of a conversation between Dr. Martin and Mr. Wood. Dr. Martin is a doctor in A&D. A&D, this is accident and emergency. And while you listen, as you listen, please make your own notes about Mr. Wood's presenting complaints. So we can discuss his problems, okay? And when I switch on the recording, please tell me if you hear or not. So let's get started.
Listening 3. Good morning, Mr. Wood. I'm
We can
Dr.
hear
Martin,
it,
one of the doctors in A&E.
Do you hear?
Yes, ma'am.
Yes, okay.
Yes, ma'am.
Great. So we'll start with the beginning. Okay.
Listening 3. Good morning, Mr. Wood. I'm Dr. Martin, one of the doctors in A&E. What's brought you here today?
I've got this chest pain.
And you seem to be having some trouble catching your breath.
Yes.
Would you like me to give you some painkillers before we go on?
Yes, please.
Okay, we'll get some for you. And I'll be as brief as I can.
Thank you, Doctor.
Can you show me exactly where the pain is?
I've been getting it right here, in the centre of my chest.
Right, I see. And how long have you had it?
For the past hour.
The past hour. And is the pain constant?
Yes. At the moment, it's there all the time.
And does it go anywhere else?
At the moment, it's just here in the centre of my chest. But it was in my left shoulder before.
Can you describe the pain for me?
It's all over here. It's not a sharp pain. It's like a tightness, as if someone's squeezing my chest.
And when did the pain start first?
It came on first when I was bending over in the garden about 2 weeks ago.
It's okay. Take your time.
And then I got this dull pain and I had shortness of breath.
So it started with you bending over in the garden, and the shortness of breath started at the same time?
Yes.
Have you had this pain before?
Not the pain in the chest, no. I had a pain in my left shoulder and arm when I was walking to work one morning about a month ago.
Okay. I see from the notes that you're a bus driver.
Yes, that's right. Not the best of jobs to be starting at 5 on a frosty morning.
No, definitely not. Did you do anything about the pain?
I thought it was a touch of arthritis. There'd been a heavy frost and I'd just rubbed some liniment into it.
How long did it last?
Off and on for about a week. And then I didn't think any more of it.
Okay. And have you felt sick at all?
Yes.
And have you been sick at all?
No. I haven't brought anything up.
Okay. I'd like to ask you some questions.
Okay. So this is the conversation. And so what do you understand? What do you understand from the conversation? And so what were they speaking about? You can tell
They were
us.
speaking about Dr. Martin asked him what is your issues, and he said that he felt a pain in his chest.
Mhm.
This was before 1 week, and a doctor suggested a painkiller. This was due to breath problems, and the site were at the center of the chest. And for past an hour, he felt a chest pain at the center of the chest, and there is a constant pain, and also this started before the chest pain started first at the left shoulder, and he felt it tightness. Then this was due to the bending over before 2 weeks, and there was a shortness of breath, and this started before a week.
Perfect. Well done. Yes. So
Thank you.
you made a lot of notes. Can anyone add something to this information?
He's a bus driver, ma'am. He said that he will go to work at 5 a.m. And he said there was no pain before, but he had a left shoulder pain from 1 month. And this when he went in the garden, like it was 2 weeks ago, and the pain was mainly in the center, but he felt a pain from the left shoulder also.
Okay, yes. And you can say what kind of adjectives does the patient use to describe his pain? How does he describe?
He said it is type of tightness in his chest.
Yes. Sorry?
Squeezing. Chest
Yes,
is squeezing.
squeezing. Like somebody is squeezing my chest, he says, yes. Okay, well done. Thank you. And let's move to the next slide. And
Listening 3.
There are more questions. So about his job.
Bus
He was
driver.
a bus driver.
Bus driver.
Yes, and the question is, does Mr. Martin follow Socrates model?
Yes.
Yes, sir.
Yes, ma'am.
He asks all the necessary questions. And what is the correct diagnosis for the shoulder pain? What do you think?
It wasn't just a symptom. It was the symptom for the chest pain. Or it was like a mini heart attack, something.
Yes, possible. Can it be, for example, angina?
Yes, ma'am.
Okay.
He thought that it was due to arthritis, but it was not due to arthritis. It may be due to angina or heart attack, something like that.
Right. Okay, exactly. And what is the treatment, immediate treatment for this disease?
Giving painkillers.
Painkillers, yeah.
Dr. Martin suggested giving painkillers to make his pain less.
And if it is connected with heart, what is the immediate treatment?
One thing we should do is, if it is something block or like that, we should give injection to remove the block through the blood vessels. We should remove the block, otherwise surgery.
I see. Okay. What about aspirin? So can we use aspirin?
Aspirin, you can use aspirin then.
Yes. Okay. Good. So you know everything. So let's move to the next slide and let's focus on some grammar. Okay, and as you see, here we are going to revise the grammar structures that were used in the conversation between the doctor and the patient. So, and the tenses in presenting complaint. As you see, understanding the time patients are referring to when they speak is crucial to making a correct diagnosis. And so here we can see 4 tenses that were used in the conversation: present simple, present continuous, present perfect, and present perfect continuous. Do you remember what is the difference between these time forms, between these tenses? What is the difference?
Present simple, we use present things and describing it in simple words.
The first one, the just chest pain. He said that he has chest pain, which is present simple. Then he said that he has it for 30 minutes long. For an half an hour, he is feeling that, which comes in present continuous.
Okay, so present simple, just when do we use it? In general, not
just
related.
to state it, man. just to state a situation that happens in the present.
Yes, and happens regularly. Yes, maybe.
Yes, ma'am.
Yeah, at the time
Okay.
when the pain is happening, while talking with the doctor, while what is the present condition right now, what is happening in his
Yes.
body or what he feels.
Exactly. Okay. What about present perfect? What kind of action does it show?
For example, while we are talking, we are reading the book. So when we are telling about him, he's feeling the pain at present too. It is continuing. The pain is continuing.
Okay,
The action is continuing.
we are speaking about present perfect. Perfect. The perfect form.
The actions that held in past time.
Mhm. Started in the past, right? Uh-huh.
Yes.
Okay, and it has some result in present, right? So it can be finished.
In past time, it's continued in this time also.
Yes. Mhm.
That is present perfect continuous.
Yes, present perfect continuous also emphasizes on how long the action lasted before it has some result in at present, right?
That was in past, and now still it is continuing.
Mhm. Okay, exactly. And now here are some rules just to refresh what we know about them. So tenses in the presenting complaint. Present simple. This tense is used to talk about something that is true at the moment of speaking. Yes, I've got chest pain. I feel better. Something that is happening on a regular basis around now. I get these headaches in the morning. It means every morning, every day, so regularly. And the process. When I lean forward, the pain goes away. The pain starts in my chest and moves up to my shoulder. So here are some rules about the use of present simple. And about the present continuous. This tense is used to talk about something that is happening at the moment of speaking. So examples, his blood pressure is rising, or I'm having difficulty breathing. So at the moment of speaking, we can also hear the word now or at the moment. They are the time markers for the present continuous tense. Then the present continuous is used to talk about something that is happening around now, though not necessarily at the moment of speaking. Examples. Are you taking any medications? It means not now at this very moment, but this week, for example. Or there is another example. I'm having chest pains. It means maybe not now at this moment, but at this period of time, from time to time, okay? And the present continuous tense is also used to talk about something that has been arranged for a date in the near future. Like here in this example, I'm seeing a psychotherapist next Wednesday. So this is arrangement for future. So it's called present, but we can use it to speak about future. So this is about the present continuous tense, and the next slide is about comparing continuous and simple time. So the use of the verb to have in the present continuous to refer to the moment of speaking is more limited than in the present simple. So it means that we can't use the verb to have when we speak about in the meaning of possession. I can't say I have a pencil. I'm having a pencil. Yes, for example, if I'm holding a pencil, I can't say I'm having a pencil. So I should say I have a pencil, because having this meaning is not used in continuous form. But it can be used in such expressions as have difficulty, have something to eat, have a shower. You can say, he is having a shower now. He can't answer the phone, right? So, and we should compare moment of speaking. I've got a pain in my chest, and around now I'm having pains in my chest. So we need to differentiate so the time to be able to understand the patient better, right? And the present perfect tense. So this tense is used. This tense is used to talk about a situation that begins in the past and which either continues up to the present or is related to the present in some way. It doesn't tell us how slowly or how quickly something has happened, only that this is the way the situation stands now. My headaches have decreased. This is the result till now. And the present perfect continuous is a similar way to the present perfect, but the continuous form describes a progressive change in the situation up to now. My headaches have been decreasing. So it means that it takes some time for them to decrease. Yes, it describes, it emphasizes that it takes just a long time. So, well, our time, yes, we have about 1 minute left till the break. So let us have the break, and in 10 minutes we'll continue, and you can join the conference using the same link. Okay?
Okay, ma'am.
Okay, ma'am.
Yes, ma'am.
Yeah, ma'am.
So see you in 10 minutes.
Okay, ma'am.
Thank you, ma'am.